Welcome. Just like to talk a little bit about my relatively new patented buttock implant called the Stanton Anatomic oval implant. This is what it looks like from the back surface, the top surface, the side, etc. These were kind of the older traditional implants, the round implant, what used to be called the oval implant, but really should have been called teardrop implant. It created a lot of confusion regarding the new implant that I'll get to in a minute. But the reason I created this implant is because there were problems with these implants. This round implant just is not a natural shape. It doesn't take up the length of the buttock naturally. A lot of times the edge pokes out beyond the edge of the muscle unnaturally, especially when patients are squatting down. This implant could look great. The maximum point of projection was a little too low for most patients. Most patients like, quote unquote, the pop coming off the lower back. And then this thing, of course, rotated a lot. 30, even 50% of my patients had rotation of this implant. And then when that happens, of course, you got a big problem. Hence the advent of kind of the combination of these two implants, the Stanton Anatomic oval implant. This blue line is for orientation. Once you have it in the patient's pocket, intramuscular, then you can retract up from the side with the arm and navel retractor, or even your finger, just to make sure it's oriented properly north and south direction. This implant, relatively simple, but hadn't been thought of before and definitely had not been patented. I took the advantages of this implant where the high point was in the center, and the advantage of this implant where it was more anatomically shaped. However, this one, should it rotate, you'll never know the difference. The patient will never be able to tell because it looks the same from the side this way as it does this way, i.e. no top or bottom to the implant. If the surgery is done correctly and the pocket's created correctly, it doesn't get stuck sideways, only but for a split second until it pops open this way or pops open this way. I've done over 200 patients with this implant since about November 2015 and have not had a single problem with rotation. Have had very pleased, happy patients, and myself have been even impressed with the outcome, to the point where obviously I never use this implant anymore, and very rarely do I use this implant, maybe 10% of the patients. I am currently getting a lot of inquiries from other surgeons around the globe, and I do host them for observation days, instructional days. I usually encourage everybody to come for at least 2 days and witness, observe at least 4 surgeries. Following that, I will endorse you having been trained under me in your local community. And then also the availability of using the implant and distributing the implant to you will be available at that point as well. That's all I have to say about the basics of the Stanton Anatomic oval for now. Hopefully this has helped you understand it better, and I look forward to hearing from you. Thanks.